According to statistics, 9 out of 10 women will experience a gynecological infection at least once in their lifetime. Currently, a very common condition that women encounter is vaginal discharge. Why do you have vaginal discharge? This is a frequently asked question among women of reproductive age. They often ask themselves, I wonder if having discharge like this is a problem. And when do I need to go to the hospital for a checkup? Before answering this question, let's learn a little bit about the female body. Women of reproductive age, meaning after you have gone through puberty, have ovulation cycles every month. Depending on each person's hormonal changes, vaginal fluid will also change according to the cycle. It might feel slightly moist, and in the middle of the cycle, the discharge will increase. However, this is normal physiological discharge that every woman may experience. So, how can you tell what kind of discharge is normal and when it is abnormal? Typically, if your vaginal fluid is just normal physiological discharge and there are no uncomfortable symptoms, it is considered normal. Conversely, if a vaginal infection is present, the discharge may turn yellow or green, have a foul odor, or cause itching. In these situations, you should see a doctor for specific advice. This is because among gynecological diseases, there are certain types of infections that can cause complications if not treated early. For example, vaginitis caused by chlamydia bacteria is a common infection in women. If treated early, it can be completely cured without any issues. However, if left untreated for a long time, it can lead to pelvic inflammatory disease, PID, and may affect a woman's future fertility. Therefore, my advice to you is, if you see colored discharge, smell a foul odor, or experience uncomfortable symptoms in the vaginal area accompanied by itching, you should go for a checkup to get treated early. Here is some advice to help prevent infections in the female reproductive organs. First, you must clean the intimate area correctly. You just need to keep the vaginal area clean and dry. Especially during menstruation, heavy menstrual flow can cause irritation and discomfort. Please change your sanitary pads frequently during these days. Do not leave a pad on for more than 4 hours before cleaning and changing it, because a pad soaked with menstrual blood is one of the factors that help bacteria grow very quickly. In principle, you should only wash the intimate area with clean water and pat it dry. Another point to note involves young married women who often tend to douche, wash inside the vagina, thinking that douching makes it cleaner. However, this is incorrect. OBGYNs advise you not to douche because frequent douching changes the vaginal microbiome. A woman's vagina has a very good microbiome. A balanced microbiome helps women avoid infections significantly. So, the principle of intimate hygiene remains: keep it dry and clean, and do not douche. For those who have never had sexual intercourse but still experience heavy discharge causing wetness, discomfort, and recurrent infections that affect your daily life, you should also visit a doctor for specific consultation. Treatment will depend on the severity of the infection. Since you haven't had sexual intercourse, doctors typically prescribe oral medication and external wash solutions. Women during pregnancy often encounter conditions like vaginal discharge, itching, and unpleasant odors. This happens very frequently because during pregnancy, a woman's hormones change significantly, creating conditions for bacteria to multiply and cause more infections. Specifically, yeast infections during pregnancy are very common. The question is, if you are pregnant and have vaginitis caused by discharge, can you use medication? The answer is yes, you can still use medication, but under a doctor's prescription. There are certain types of anti-inflammatory drugs for the intimate area that are completely safe to use during pregnancy and do not affect the fetus. Because if an infection during pregnancy is not handled well, it can lead to an increased risk of amniotic membrane infection, chorioamnionitis, or cause premature rupture of membranes, PROM, and the risk of premature birth. Therefore, if you are pregnant and have abnormal vaginal discharge or experience itching and bad odors, please discuss specifically with your doctor so they can assess the severity of your infection. The doctor will advise you on how to clean and use medication, such as suppositories, appropriately to prevent complications of vaginal infection that could affect your pregnancy. One more thing is that using feminine hygiene washes to support the treatment of gynecological infections depends on the specific type of infection. The OBGYN will prescribe a wash with an appropriate pH level for you. There are many cases where people use salt water to clean the intimate area themselves. This is not recommended because for those with overly sensitive skin in the intimate area, using a salt solution that is too concentrated can cause irritation and even more inflammation of the vulva. Therefore, the doctor's advice remains: keep the vaginal area clean and dry and go to a doctor for a specific consultation. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.